The game has changed whether you're a technology provider, a health service provider, or a professional. And if people can at least get one message from the roadmap, it is that the time for contemplation and thought is long past. And if you don't do something now, it will be done to you.
Hello and welcome to Pulse Amplify, where we sit down with the leaders and change makers shaping the future of health. Proudly brought to you by Pulse IT News. I'm your host, Louise Shaper.
And I'm your other host, George Margellis.
Today on Pulse, we are joined by Professor Enrico Coiera, one of the most influential voices in health informatics anywhere in the world, and someone whose thinking has shaped how Australia approaches AI in healthcare. Honestly, his thinking has shaped so much more, but today we're going to be focusing on AI. Enrico is Professor of Medical Informatics and Director of the Centre for Health Informatics at the Australian Institute of Health Innovation at Macquarie University. He's also the founder of the Australian Alliance for Artificial Intelligence in Healthcare and lead author of the newly released Don't Walk, Run, Australia's third national policy roadmap for AI in healthcare, which has 28 recommendations across 8 priority areas. Now, the Alliance's timing could not be sharper. I don't know if you planned this, Enrico, but just last week, the Albanese government here in Australia announced a new Office of AI and National AI Standards to be legislated in early 2027. And overseas, a Chinese lab just released one of the most capable open AI models yet. Enrico, we are so pleased that you can come on the show and dissect all of this for us. It is a genuine pleasure to have you in the studio. Welcome to Pulse Amplify.
Thank you very much, and I'm delighted to be with you guys.
Great to have you here, Enrico.
All right, Enrico, your roadmap, it's titled Don't Walk, Run. The whole through line is urgency. So what's changed since Roadmap 2, which came out in 2023, that made run the mantra this time rather than let's walk carefully?
This is a really important issue, which is that we have moved into a period in history where we have 4 or 5 hyperscaling companies cashed up to sums that are eye-watering, that are aggressively improving technology month on month, and they really need to somehow monetize all this so they survive. And what they're doing is pursuing very aggressive business models. And one of the richest pickings is healthcare. So the reason that there is urgency is not that we want to accelerate adoption of AI, but we need to get ahead of this truck so that we adopt what we want in the way we want and not have things done to us by external companies.
Yes, and I know people will be like, well, let's talk about OpenAI and Anthropic. Well, we're going to get to that in the show, but let's talk about the roadmap first.
So looking at the roadmap, you have 8 priority areas and 28 recommendations, and it's a well-written document with some really good graphics. Just run us through the priority areas briefly, and in particular, which ones you think are most critical at this stage.
Sure. And I might start by saying that these recommendations come from the membership of the Alliance. So it's about 150 organizations, health service providers, government, industry, academia. We ran this process nearly over a year, George, with about 90 full submissions. And then we had 20 focus groups and interviews with key agencies and stakeholders. So this is not something that just bubbled out of nowhere. It's really a distilled reflection of where the community broadly is at in terms of AI and adoption. We offer people areas of focus and see if they agree with them or not. And interestingly, for the last 3 roadmaps, the number one area has been safety. But there'll be new areas that have popped up like sovereignty of AI, control of AI. The thing that is probably our number one recommendation, I get asked often, if you could only do one thing from the roadmap, what would you do? And that really is for the need for leadership and a national plan. It's really difficult to understand how healthcare, which is so critical and so complex in this day and age, does not have a coherent national approach to how we embed AI into the way we deliver care. So that is the starting point.
Absolutely. And the other areas, we've got things like workforce, consumers, there's things for industry in there as well, research and development. What's your key audience for this document? Who should be reading it?
I think there are 2 broad communities. There's a smaller one, which is the most powerful one, which are those who set policy, whether it's at federal or state level, or even, let's say, at professional level. And what we're trying to do is to wake them up. There is still very little movement, for example, in the healthcare professions in Australia. I know one or two of the medical colleges, for example, do have AI embedded in their training programs, but a lot are still curious. So it's very strange in 2026 that you are AI curious and not boots in, given how much is happening. The other broader community are the people who deliver healthcare services or support them with technology. Again, because there is a sense of business as usual that I see, where we can just proceed methodically with the old ways of doing things. And that clearly is not the case. I think the game has changed, whether you're a technology provider, a health service provider, or a professional. And if people can at least get one message from the roadmap, it is that the time for contemplation and thought is long past. And if you don't do something now, it will be done to you.
Yeah, absolutely.
Because if you look at EMR adoption, it was a 20, 30-year journey. This really has been on the rocket since 2022 when OpenAI launched ChatGPT. So the timeframes are just becoming shorter and shorter. And we often hear about it taking 17 years for ideas to be adopted in healthcare, but we don't have the 17 years. We don't have 17 weeks. So it's a real challenge.
That's right. One good example is digital scribes. We wrote the first paper naming digital scribes probably 4 years ago. And now it's a global marketplace. So the idea of naming the thing and it might do X to it becoming a pervasive market technology happening in just such a short span of time is just unheard of. The other big thing is that I think healthcare, because of the EHR, EMR paradigm, is used to these mega procurements that take years. And that is just not how the AI world works.
Enrico, I just feel it's crazy. In 2026, there is still no coordinated national approach to AI in healthcare. But your roadmap number 2 called for a national plan by the end of 2025. So what actually got in the way? Is it money, machinery of government, political inattention, all three? What's been going on? What do you hope can change now?
It's not that nothing happened. We have made progress. So in the last 2 years, we've seen movement on the creation of professional responsibilities in the code of conduct. We've seen some of our state public health systems put out guidance on the use of AI. We have seen our TGA, like the US FDA, be quite explicit about AI being a medical device and needing to be regulated. So it's not that nothing has happened. But what has not happened is national coordination. There has been movement within federal government, what they would call whole of government approach to AI. So departments talk to each other, but that has not translated into a whole of nation engagement with all the other key stakeholders. You know, healthcare is such a large, complex ecosystem. Government can't nor should it do everything, right? So it needs to come from industry, from the professional bodies, from consumers. We all need to be part of the solution and the story. And that's what a national plan would hopefully bring together. So why didn't it happen? It was only last week that the government finally said AI is a national priority by putting it in the Prime Minister's office. And that's a really important message. But it's a delayed message, right? I think in the UK, they actually have a minister for AI, not just an office. So we need to be doing more. And I think Australia historically has left these things to the market and to overseas to do the front running, not recognizing that we really need to be doing things here on our own. As I've said before, if we don't do it, it's going to be done to us.
So obviously the Prime Minister's office became aware that you were about to launch this roadmap, and that prompted him to launch his own for Australia. And we've seen an announcement of things like an Office of AI, national standards to be legislated. And we've seen a big push around sovereignty of data centers and management of data centers. But if you look at the Prime Minister's recommendation, healthcare is not highlighted as an issue. What are we doing to make sure they're all working in the same direction? You touched on whole of government, but does the Department of Health need an AI department and an AI lead to play an active role? We had national cabinet meetings back during COVID that enabled them to coordinate themselves.
It's very early, given that the government's just set up its office in the Prime Minister's office for AI. There are sections of the Department of Health that are devoted to technology and AI. And I know that those guys do chat with regulatory agencies. They do chat with other ministries. So internally, I think they sort of are getting their act together, which is fantastic. But that's just within the feds. So each state is pursuing its own agenda. I know my own state here in New South Wales, there is a large effort being put into a state AI strategy and embedding AI into the health delivery processes of the public system, but they're not all joining up. And so our recommendation 1 is that the federal government needs to lead on this and bring everybody together. I think they are best placed to be the convener and guide of this. As long as they don't think that they are the ones who need to provide all the answers, because they can't, then we're in good shape. Let's see how things progress over the next few months, whether we move to AI time or not. I don't know, George and Louise, if you remember, we used to have internet time, which was meant to be 3 to 4, 5 times faster than how things used to be. I don't know how fast AI time is, but I'm aging as we speak.
Well, we like to age because the alternative is less desirable. You started the Alliance in what year?
2018.
There you go. So for anyone who thinks AI is like a new thing since ChatGPT, you and your colleagues have always been really pushing the boundaries of this and wanting people to take this seriously in healthcare. Are you expecting a call from the Office of the PM anytime soon? Because this is too complicated an area for the PM's office, no matter how well-intentioned, to get this right without assembling a collaboration with key experts in the field.
I expect that the PM's office will focus on things that are whole of nation. So issues around copyright and IP control really go across all sectors. In arts, it's about if I'm an author and my text gets used to train a model. In healthcare, it's if my medical record gets used without my permission. I have IP rights over my record. So there are going to be issues like that where you can safely put them all in one bucket. I think there are many sector-specific nuances. There will, for example, be quite a focus, I'm sure, on safety of AI, but there's no question that what might feel like tight regulation in another sector will be too loose for healthcare. Healthcare, we really have very high risks, and the requirements for safety are appropriately very high when we regulate technologies. So I would not imagine that we would centrally devalue what the TGA does in terms of medical device regulation. In fact, I would suggest it's the opposite, that sectors like healthcare can teach other sectors what to do in terms of regulation, especially around safety. We already have highly effective processes. They know their challenges. They know what generative AI does in terms of challenging the old-fashioned approaches to regulating medical devices. So they just need resource and support to keep running. And I would be really surprised if anybody got in the way of that. So I think sector-specific is absolutely required. I expect most of the running will happen in the Department of Health for healthcare.
One of the things that does highlight, of course, is that fragmentation of our healthcare system. So we do have lots of AI projects running, but in isolation in different parts, and the state, federal, private divide, and all those sort of things we've discussed many times in the past. The need for this to have regulation, the government's explicitly said they're not going to legislate a standalone AI Act, but things like guardrails and having common standards across the whole sector. We've seen the challenge when we didn't have common standards in healthcare records, the problems those cause. Is there a standards-based body that would play a national or even a global role in this space?
Australia has something called the Digital Health Agency, ADHA, and you would expect that because they have control or oversight of interoperability standards, that they would have a role in the AI space, and I know that they are looking at this. So they might be the natural home for AI standards work. There clearly, though, are other kinds of standards, not just technology standards. They're going to be standards around skills, and that will come from the regulators. There will be standards around quality of health services, and that comes from the health accrediting agencies like the Australian Commission for Safety and Quality, which goes in and accredits hospitals, for example. So they're all going to be holders of different sorts of standards. And as I speak, it's obvious they need to talk to each other. And I know that they do have some conversations now, which is great. But if we do move to a more formal structure, more coherent and joined up structure, then we're going to need to make sure they all reflect each other and are not going in different directions.
Enrico, one of the sharpest framings in the document, and you mentioned it at the start of our conversation, is these handful of hyperscaling international companies and the fact that they're trying to become the de facto front door for consumers managing their health. And George and I discuss this almost weekly on the pod, and I've just come back from England where I was giving talks on this topic as well. And I don't think healthcare has necessarily widely cottoned on to the fact that the front door of healthcare has already changed. You know, William Gibson's quote of the future being here already, it's just not evenly distributed. I think this is more apt a time to apply Gibson's thoughts to technology than ever before. But this is happening, and this technology, unlike pretty much anything else that's come before, where healthcare has had a choice. In the four metaphorical walls of healthcare, I decide as the minister, as the executive of the hospital, as the clinician, we decide what technology we're going to use here, how we're going to procure it, how we're going to get people to use it or not. Yet this technology is going straight to consumers and indeed straight to clinicians. It's something that we can't control, but it's having vast impact. And I really think it's going to start changing the demand curve for healthcare. So how do you think the healthcare sector should respond to this challenge of these hyperscalers that aren't healthcare companies, but they're acting like one?
This is probably the biggest driver for the framing around urgency. Don't walk, run. It's very clear that people are going to the large language model-based services of the hyperscalers for healthcare advice. ChatGPT gets something like 230 million health and wellness queries every week. And you compare that to the 2 million per year queries that Health Direct, for example, gets about vetted high-quality information. So there's no question that people are going there. The deeper question is, how do we respond? My fear is that we are repeating the cycle with Uber, where we create a compelling on-the-ground story well ahead of regulation and response, and it becomes the de facto truth. So to do nothing, it's very clear that in 3 to 4 years' time, the digital front door to healthcare would be run by 4 or 5 North American West Coast companies at the control of government there, which may or may not be rational. So those are not good foundations for the Australian healthcare system. What can we do? If it's a market, we need to compete. And we need to compete by offering a better quality service. One of the things that I enjoy most in the roadmap is how we can create digital front doors to the most critical national services that we offer in healthcare. For example, aged care is really a very difficult sector for consumers to navigate. I've had to navigate those services for my parents over the last few years. And it's not one website, it's multiple websites. They don't all talk to each other. The knowledge you need to even use these websites or what's available to you is hidden. If we were to be able to provide a single conversational front end across all of those services, from the consumer perspective, I'm getting access to what I need. It's in a way that I understand. And also, we don't rebuild these monolithic IT systems behind the scenes. The AI is the expert at navigating the pre-existing systems. So if you do something like that for aged care, for my health record, for the health services offered by hospitals, etc., then people need to go there anyway, right? These are compelling must-do interactions with the healthcare system. And if that is a better interaction than being offered by these North American companies, then people will use those, I'm sure. So making sure it's not just providing information, but it's direct access to humans, direct access to services. So I think the complexity or the moat, as it were, for Australia is going to be around us owning the health services we provide and that not being something that can be taken over easily. It's easy to take over providing information. It's much harder to take over providing services.
Time for a quick break, and when we return, we're going to be discussing more about sovereign capabilities and the open source models that are coming out of places like China. We're also going to be discussing workforce and asking Enrico, are we thinking enough about what AI does to the workforce, not just for it? And also discussing consumers and the role of the patients use AI movement. And if Australia gets this right, what is it going to look like in 10 years from now? And let's hope we do. Back with more soon.
We have seen big IT companies try to get into healthcare in the past and often with very limited success. But this seems different. We've had this current dedication to these US predominantly LLM models, but we've seen a lot of things happening in China. China's launched things like Kimi K3. And then in Europe, the French have Mistral and the Germans have Lumina. So there are other LLM models out there. Do we need to do that same level of work here to actually develop a local sovereign LLM that we control, that we manage the content for? Challenge being, of course, that we're now talking petabytes of data for training, and how do we manage that? Or can we license something and use it, or can we take an open source model and fix it up here? There's lots of technical aspects of this, and obviously the engineers are the ones who are going to solve some of these issues. But what do we mean when we talk about a sovereign solution? Does it just mean it's hosted here? Does it mean it's more than just sitting in a local data center, I think?
So, George, this is really an important area in the map. So sovereignty means control. In other words, we're able to control the way AI behaves, and we can control the services it provides. Imagine we've run 10 years into the future. Models now are embedded in the foundation of healthcare and providing the sorts of services we've talked about. Imagine now if those are strictly North American foundation models run by North American corporations, and for some geopolitical reason, they get turned off. What happens to the health system in Australia? Does it just not provide services? Does it go back to paper? What goes on? What happens to our beautiful front end to aged care services, to 1-800 Medicare? So this is where we need control. And there is a very recent experience we all had in the pandemic where we didn't in Australia have sovereign control of vaccine production. And we had to wait over a year before we started to get access to vaccines made overseas. And later on, we did have the capacity to start to build our own vaccines, molecule by molecule. So we were exposed because we didn't have sovereign control and sovereign capability. And this is that problem on steroids. So what is the answer? It could, as you say, George, be that we take state-of-the-art open source models. And you mentioned K3, which is Chinese-based. But it doesn't have to come from there, it can come from anywhere. The amount of effort involved in building one of those can come for free, as it were, and we can just spend time localizing and customizing the technology. And in fact, one of the sovereign things we are going to need in Australia is that skill anyway, because AI performance is very based on local circumstances. So the populations we have in Australia are different to the populations in Europe or North America or Africa or Asia. The way we provide services are different. And so the advice that we get from the generative AIs may not always line up. So we are going to need anyway, whether it comes from a hyperscaler or it comes open source, to localize and customize the AI. So we might as well make sure that is the right way of developing sovereign capability. I can't imagine what will happen over the next few years, George, but I can equally imagine one of the hyperscalers saying, we're happy to give you a local instance that you have local control over and that we can't touch. Australia says, look, we really need an absolute firewall behind all this. We need an important rollback. So we will build our own sovereign foundation models customized to Australian population needs. And there are arguments for and against all of them, and I'm not going to advocate for one or the other. But it's absolutely crystal clear to me that if we do not have sovereign capability and sovereign control over technology, that we are going to be geopolitically exposed over the next decade or two. And nobody's going to debate that we are entering a much more unstable global situation where we may not have control. We saw, for example, just a few months ago, a new release of one of the LLMs was retracted and blocked. So you couldn't use this LLM anymore if you were overseas and not in North America. We can't bet our health system on that sort of behavior.
No, and unstable governments that we can't control, but also these hyperscaler companies, privately owned. It is so scary, the fact that one person can decide whether me in the bush using a certain service that collects to the satellite could decide to turn it off. And there's nothing I can do about it. And we've seen that happen in the Ukraine war as well.
Exactly.
Like, great, I'm glad that Elon's on the side of the Ukrainians in that instance. But at the same time, it's so negligent of us as a global society that we've allowed one man to decide who can access the internet or not. And you just hope that he's on your side. It's insane that we've allowed that to happen. Social media has taken so much control away from individuals while posing to do the exact opposite. And now with AI, those things will seem minor in comparison to what could happen here.
It's even scarier that we let the guy run around with a chainsaw at one stage as well. So
I'm wondering which guy you're speaking about.
I know, who could it possibly be? Enrico, let's talk about the clinician workforce. Your roadmap has a whole thing on workforce, but it does say that AI could reshape clinical work in ways that we're just not ready for. And George and I discuss this a lot, again, almost on every episode. So are we thinking hard enough about what AI does to the workforce, not just for it?
This is also a really important emerging issue. We know that AI brings benefits, and the example we can chat about is scribing and automated documentation. There's no question that it's a good enough technology. I would still say that the safety profile of these technologies has yet to be fully demonstrated, so it's a separate argument for another day. And it does reduce cognitive load or the sense of burden that many clinicians feel with documentation. But there are side effects, as it were, that are concerning. For example, when clinicians take a history, interview people, and then eventually start to write notes, what they're doing is building a model of the patient in their head as they go. And that act of model building disappears when a scribe does the job for you. For very routine patient encounters, we're going to probably have efficiencies, but for complex patients, you really need the human fully engaged in the loop. So we don't think about that. We don't talk about that. We don't talk about what kinds of healthcare jobs there will be in 5 to 10 years' time, probably because we can't imagine them. I'm less comfortable telling you that clinical work will look like this or that in 10 years' time than I am saying absolutely it will be different. It will be different in all sorts of ways. I know that all around Australia, as clinicians do ward rounds in hospitals, they're probably using one of the smartphone-based apps, WhatsApp or Instagram or whatever, to talk about their patients. Completely unacceptable in terms of divulging patient-specific information to international companies. But work is already changing. In some sense, work is very local for a clinician. They just do what's in front of them with the patients they see at the time. But for those of us who live in a richer technical world, we know that work doesn't stop once you enter this world of connected apps, etc. So I'm just not sure what turning off or doing your job looks like when I live in a world where AI is in the foundation of everything I do. And I'm not sure whether responsibility for the final outcome will ever shift from clinicians. So it's a bit scary where we are going to still be responsible for outcomes, but maybe with AI out there, not really being in control of what's going on. One thing that I remember from a couple of years ago, speaking to one of the scribe companies, was my inquiry about physicians checking the output of the scribes. And what they said to me was you could see in the first week of use that there was a lot of engagement with checking documents. And after that, people just stopped doing it because they presumed it was doing the right thing.
That quickly. Wow. Yeah. Okay, because I figured that would happen, but I didn't realize it would be so quick.
Yeah.
And that's just using one AI. Imagine now that everything you do has an AI behind it. So the risks of automation bias are extremely high. So I think let's not be clear that we know exactly what work will be looking like, but let's absolutely work really hard to imagine where it might go, imagine the challenges we face, and try and mitigate them now before we end up in that big hole.
There was a very concerning article came out in Nature Medicine a couple of weeks ago titled AI-Induced Never Skilling in Medical Education. So this concept that young doctors are actually basically so reliant on AI that a lot of the clinical skills that we develop through exposure are no longer there. I guess this is part of the stuff we need to make sure we manage so that they understand the benefits, but also the drawbacks of AI. And I remember I was once at a hospital that its EMR got pulled out of use because of a technical issue. So we had to go back to paper forms and pens and paper. So yeah, there's always that requirement. The other part, of course, is the consumers. The clinical workforce has a professional responsibility to understand this technology if they're going to be utilizing it. But in the wide world, we're finding that the consumers are using AI, and often their use of AI is better than the use by professionals because they have a requirement to get information that they can't get any other ways. We've seen people like ePatient Dave, and we've had a couple of people on our podcast. But how do you make sure we upskill the consumers? And you do touch upon this in the report. The consumers need to also understand the pros and cons of the AI and the requirements around it, because it's so easy to circumvent it. Even if we do block it with a VPN, you can get onto someone else's LLM and wreak havoc with your data.
So we're going to have to presume, I think, that most consumers engage with some kind of digital experience before they seek advice. And what we want them to do is to be skilled in sifting the real from the fake and understanding how they should use the information they receive. I think it's important, for example, to explain to patients and consumers how best to bring that information into the engagements you have with clinicians. We've all seen those mugs about my opinion is better than an internet search. I'm not sure if your opinion will be better than an AI-based response, but we'll see. So the real question is, how do we do that? And the initial suggestion everybody is let's have training programs, let's put information online. That will do it. And it clearly won't, because people won't go to that. What we say in the roadmap is let's find some kind of natural home where we can do that. And we think providing short, sharp educational moments as part of your natural interaction with the health system might be the place to go. So if you do go to Health Direct, if you go to our new All Singing, All Dancing, My Aged Care front door, that is the time when you can help people take a little bit of time back and train as they go. So you can, just as part of the interaction, have little snippets about, by the way, did you realize, ... So that's one way to do it. We also do think, though, that there is sort of an imperative, especially around disinformation, or even not disinformation, but the fact that information is sourced from different places. The example I always give is vaccination schedules. The US recommended schedules for vaccination don't line up with the Australian ones anymore for various reasons. And we would need to be able to provide people information about how to read those things and understand perhaps why there are differences and what the Australian recommendation is in terms of vaccination and the evidence base. So you've seen in North America, for example, that some of the evidence behind things is no longer publicly available or has been removed from those government sites. So there's a lot to be done. I don't think it's trivial. I think special populations, culturally and linguistically diverse populations, require special attention. They're probably disadvantaged today in terms of interacting with AI. So we do need to make sure their special needs are there. Australia's Aboriginal and Torres Strait Islander populations have special needs around their data. We need to make sure that anything that we do in terms of training is culturally sensitive and appropriate. So a big area. I think one of the things that strikes me as I'm talking to you today is 28 recommendations, 8 priority areas. There's an awful lot to do. And I'm saying let's do it quickly. So the scale of what we have to do is huge. And my sense of optimism or pessimism varies depending on whether or not I think government will engage to do this. And it also underlines why I think this can't only be done by government, because we just need too many hands.
Yeah, we need it to be all-encompassing. Well, Enrico, you've written 3 of these roadmaps, so well done, the Alliance, for being so proactive here. But, okay, it's successful. 10 years from now, Australia got this right. So what does that look like if we get this right in a way that genuinely serves consumers and clinicians?
If we get it right in 10 years' time, I would expect Australians would be accessing digital front doors first for many of their needs. They would be AI-enabled. It would reflect Australian content and services. It would be always on and sovereign, so we wouldn't be able to be influenced by what's happening geopolitically. And we are using AI not because AI is cool, but because AI makes us more capable health service providers. So I would like to see the dividend also coming. I'd like to see less of government spend on healthcare. I'd like to see better healthcare outcomes. I'd like to see consumers taking much more evidence-based engagement with their preventative activities and their wellness activities. So we should be a nation on the way to being amongst the healthiest in the world, and we'll give those Scandinavians a run for their money.
All right, they might be able to beat us in football, but we can try. And I love that, Enrico. Thank you so much. It's good to end in a positive light. And thank you again, not just yourself, but your entire team, all members of the Alliance, and everyone who contributed to putting this document together. It is incredibly important. It is incredibly well timed with Anthony Albanese's Prime Minister's announcement. All of our listeners here at Pulse will be paying close attention to this. And we are also putting up our hands to help. So anyone who's listening from the government as well, you've got an entire community of thousands and thousands of people who want to help you get there. So this is very much a community effort. And Enrico, thanks for coming on the pod and helping us celebrate this great achievement, and let's hope it gets implemented.
Thank you for helping me tell this story.
Thank you.
Thank you for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by me, Louise Shaper, with audio engineering by the amazing Ivan Jurek of Octopod Productions. Thanks to Emily Mara, co-founder and publisher of Pulse IT News, for all of her support. And big thanks to you, everyone, for listening. Please make sure you subscribe, follow, tell a friend, rate us wherever you get your podcasts. And don't forget, you can visit pulseit.news to sign up for the e-newsletters and explore Pulse IT's huge, massive digital archive. Send any feedback or topic suggestions to George and I via email at pulsepod@pulseit.news. We always love to hear from you guys. Have a great day.